Hello, ladies and gentlemen. Welcome to Triple N Talk Show. I am Dr. NIK NIKAM, and this is our first broadcast, which is being live streamed to YouTube, to Facebook, and it will also be live streamed to YouTube. We welcome you, all listeners, and today the topic is going to be coronavirus vaccine. We get you an overview of what is happening with the coronavirus pandemic and focus on vaccine. Where do we stand as far as vaccine is concerned, and how do we get vaccine? So let me begin with my little PowerPoint presentation I have. Let me begin with my PowerPoint presentation I have. Okay, ladies and gentlemen, welcome to COVID-19 World News. The topic today is COVID-19 vaccine update, January 6, 2021. Welcome to all our listeners here in the United States and all across the globe. As we can see in this chart, back in March, we had less than 50,000 cases per day. But as of January 2021, the number of cases reported in the United States is well beyond 225,000 new cases per day. That is a five-fold increase in the number of new cases from the numbers we saw in March and April. And as far as the death rate is concerned, back in March and April, we had a death rate which was just about 2,000 cases per day. And here the death rate is approaching 2,600, 2,700 per day. And you can see the disparity between the the magnitude of the number of new cases detected versus the death rate, which hasn't really matched with this exponential rise in the number of acute cases. But nonetheless, the hospitalizations have dramatically doubled or more than twice compared to what they were in the first wave during March and April. So we'll talk about this disparity in a minute. Well, this is just not related. This is just not concerning the United States. Here, if you look at the Europe, France had a peak of 800 new cases per million population just about in November. But look at the United Kingdom. United Kingdom is leading Europe with more than 800 new cases per a million population, which is the highest compared to most other countries. And here is Germany in this light yellow color, which is seems to be they are all leveling off, with the exception of the United Kingdom, which has forced Boris Johnson to implement a nationwide lockdown till the middle of February. We're talking about till the middle of February in the United Kingdom. Similarly, German Chancellor Angela Merkel has implemented lockdown until January 31st. So this is the magnitude of the coronavirus all across the globe. In England, now 1 out of every 50 person is supposed to have COVID-19 infection. And I talked about the magnitude of the rise in number of cases during December and January as compared to March here in the United States. As I said, we had less than 50,000 max during March and April, but now we were approaching almost 250,000. That is a five-fold increase in the number of cases, which may be related to the number of tests we are able to do at this time. It may also be related to the number or the percentage of people who are tested coming as positive. And the third and the most important point is number of people who are testing positive who may not be infectious, in the sense they may not be having the live viruses, and they may not be passing on the viruses to other people, because the tests that we use to detect the coronavirus infection, which is PCP test. It is detecting not only the live virus, it can also detect virus remnants and dead viruses. And that's why there is a disparity between the exponential rise in the number of new cases, which is 5 times or fivefold compared to that we saw in March and April, whereas the mortality or the death rate has gone up by just maybe 25% or so. This is called as the case-demic. Of course, we are in the midst of the worst pandemic of the century, but nonetheless, this is called the case-demic, where we have a number of cases which are fivefold greater than the number of cases seen in March and April, but the mortality is not 5 times as large as it was in March and April. So let's keep that in mind. But nonetheless, as I showed you in the first graph here, let me go back. There is an increase in the number of hospitalizations, which is a major concern, which has stretched and stressed the entire healthcare system, not only here in the United States, but also all across Europe and the rest of the world. Even China, South Korea, Japan, they are all experiencing this third wave. Okay, let's continue here. Here in the United States, just yesterday, they reported 233,626 new cases. The leading states are, of course, California with 37,000, Texas 21,000, and Florida 15,000, and the numbers keep going. And in fact, the mortality also has gone up. Okay, that brings us to the question of vaccine. As you know, the Pfizer vaccine was approved just about 3 weeks ago, and I have already seen some of my medical colleagues receiving their second dose of Pfizer COVID vaccine and posting their pictures, which is a very good sign. But we are more concerned about the vulnerable population, about the people who are 65 and older, and when can they get the vaccine? How big is the challenge that we face today in terms of vaccine? So let's take a quick look at that. And here is interestingly, I posted a vaccine update on January 3rd in the physicians' Facebook forum, where there are more than 150,000 subscribers. And I received more than 365 comments on that and got a lot of ideas, which sort of inspired me to make this presentation so we can share our information and we can learn from each one of us, so that more and more people can get vaccinated. And just to show you, this is as of January 3rd. More than 13 million doses of vaccine was distributed, but only 4.28 million people received the vaccine. That accounts for 32% of the doses that were shipped. The real question is, what is happening with the 68% of the vaccine that was delivered but has not been administered after 3 weeks? This is a real question. And if you look across the board here, every state, California, Texas, Florida, and every state has an average of 35%, while the remaining 65% of the vaccine is sitting in freezers, while people are desperately looking for where they can get these vaccines and when they can get the vaccines. The only place that performed better was in the prison, where they got their vaccinations from the prison officials. There may be something that we might learn from this. I'll come back to this in a minute, but I'm more concerned about the 65% of the vaccines that are sitting in the freezers at various locations that have not been administered. This has also brought attention to the governors and also to the state officials as to why it is sitting there. And if you realize it takes 2 weeks to vaccinate 5 million people, and you try to calculate, it will take more than 2 to 3 years to vaccinate the entire US population, which is 330 million. The question is, do we really need to vaccinate the entire population? In order to answer that question, here I pulled up the United States Census based on the age group. Right now, the focus is on people who are 60 years or older with one or more risk factors, and of course, the healthcare workers, the frontline workers who are already receiving that. And this population accounts for maybe 1/3 or less of the United States population, which needs to receive this vaccine within the next 3 months. I mean, that is my goal, and I'm going to discuss as how mass vaccination across the country can be implemented with a plan that I have figured out. Okay, if you look at the population, there are 86 million who are less than 21 and 38 million, 65 million. We are concerned about the people who are between ages 55 and up, or 60 and up, which accounts for about 80 million people. That is as far as the public or the population is concerned. And according to the CDC, the health sector in the United States employs 18 million healthcare workers. So an interesting point is 80% of the healthcare workforce are women. How about that? Hey, women. There you go. So we are talking about 100 million people who need to receive a vaccine in the next 3 months, which is 100 days. That is 1 million vaccines to be administered each day in the coming 3 months. How are we going to accomplish that? Okay. Do we have the vaccine to administer that? That's the next question. As you can see, Pfizer shipped 25 million doses of a vaccine by December 31st. Moderna shipped 20 million doses by December 31st. And by March, Pfizer is supposed to supply 75 million units, but that has been cut to 25 million units due to supply chain issues. Same thing with Moderna, which is supposed to supply 180 million doses. I hope Moderna will step up to the plate and deliver those 100 million units, that are 200 million units, to vaccinate 100 million people by March end. I mean, that is my expectation. Okay. See, doing mass vaccination is nothing new. 160 million doses of flu vaccines are administered in 6 months period every year. And most of this is done at the local places like the primary care clinics, emergency care centers, Walgreens, CVS, and all these things. But when it comes to the coronavirus vaccine, it is much more complex. It is much more resource intensive, and it also involves record keeping. Excuse me. It involves record keeping. So there's no doubt we can have the primary care doctors, clinics, urgent cares, and every other place who can administer the vaccine can get the vaccine that is needed and begin administering the vaccines. I just saw a news from CBS. Which it will be busy until 25th, just vaccinating the folks in nursing homes and long-term care. I don't know about Walgreens pharmacies, but my feeling from studying all this is that we need a federal, state, city, county teamwork where we establish mass vaccination centers in each major part of the city, so that we can reach not 100 patients, not 1,000 patients, at least 10,000 patients per center per day. I mean, I'm going to show you in a second. And this can be done. And we have done in many ways during Hurricane Katrina and Hurricane Harvey in terms of providing facilities and support services. Okay, this is the proposal I put together, which I have sent it to Sugarland Mayor and also Houston Mayor. And that is, we have so many event centers. We have so many event centers which are lying vacant. There are so many people who are unemployed. I think we should get the state, the federal government, the state government, the city government, the municipalities, along with the help from FEMA and National Guards, to set up centers, just like they set up the Javits Center with 1,000 beds in 3 days. We can set up vaccination centers like at the NRG Arena or at the Astrodome, any places where they can have large number of people, large parking areas, and in that way we can vaccinate tens of thousands of people each day. If you are building a Bentley one car at a time, it's going to take you forever, versus a GM producing 10,000 cars a day. That is the approach we have to take. So if we involve all these teams and put up centers like the Javits Center that was put up in New York City, we should be able to vaccinate 10,000 people per day. There are a lot of people who are 65 and older who do not have primary care doctors, or who are not able to get into the primary care doctors. As I said, it is resource intensive, and primary care doctors cannot deviate their time to a full-time vaccination program. All right. Of course, at the present time, people who are eligible for vaccine as of January 6 are the healthcare workers, people working in outpatient settings, urgent care centers, and community pharmacy staff, and also people who are 65 or older with one or two medical conditions. And Governor Cuomo has said that he's going to fine up to $100,000 for hospitals violating the rules or giving vaccinations to people who are not in the primary list during the first few weeks. And he is also he's also recommending suspension of medical licenses for doctors who give vaccination to people who are not in line to receive the vaccine at this time. And this question of mutation, we have heard about the UK coronavirus mutation, which is rampaging through the entire United Kingdom. And there is a more virulent type of a virus that is brewing in South Africa. However, the researchers at Oxford University say that this vaccine they have should be able to address the UK coronavirus, and they feel that it can also address the South African coronavirus mutation. But only time will tell us once these people are given vaccine and see what happens. Well, at least we reached a stage where we have vaccine. But now science and politics competing for the same vaccine. What do I mean by that? Well, the leaders, the political leaders are trying to make rules about vaccine, not based on science, but based on politics and logistics. In England, they were talking about delaying the administration of the second dose by as much as 12 weeks. And folks here in the United States were talking about dividing the Moderna 100 microgram vaccine into 2 doses. However, the FDA cautions that it is not based on science, and they would not recommend that to the general public. And I talked about the mutation of the coronavirus and whether one size fits all is something that has to be determined. But the researchers say that within a few weeks, they should be able to develop a vaccine that will work against the UK mutation or the South African mutation. Okay, where do you go and get vaccine here in Texas, especially in the Houston area? But before I go to that, and I'll show you actually the website where you can go. And as you can see, as of January 3rd, they had received almost 900,000 doses, but they administered only 365 doses. All right. Now, if you look at here, as of today, January 6th, the Texas Department of Health and Human Services shows they have administered like 475,000 units of vaccine, even though they have received 1.375 million doses. The real question I'm asking is, why are the remaining doses sitting in the freezers? Why they haven't been able to distribute? And that's why I propose that mass vaccination plan, which I have already sent to mayor in Sugar Land and also to mayor in Houston. Okay, this is the website where you can go and find out where, excuse me, where you can get vaccination. But let me see if I can bring this one up here and share the screen. Let me see how to share the screen here. Stop share. Let me bring this back 1 second. Well, I'm trying to see if this, okay. Can you all see this screen? Okay, this is the screen where you can actually visit. This is called the Texas COVID-19 vaccine. This is Texas COVID-19 vaccine provider locations. And here you can actually zoom into your location and see which clinic has how many Randall's Pharmacy on Highway 6 has 100 doses. Every HEB I checked has 100 doses, which is cumulative water and doses shipped. There's no information on how much is administered and how much is left. So this website, even though it has information, it is grossly inadequate to find out where you can get the vaccine. That's one of the things that needs to be improved. And there are, if you look at, this is not enough to vaccinate the entire population of 4 million people in the Houston metroplex area. And this is, you're looking at Houston area. That's why I propose this mass vaccination centers to be set up in NRG Stadium, Astrodome, and other places which have not been used for events, things like that. Okay, so let's get back to here. Let's see what else I have with my PowerPoint. Excuse me, I had to share my PowerPoint again. Okay, so that's the slide about this one. And if you're a physician and you want to be a vaccine provider, this is the place where you go. I would just say, search under Google Texas providers, COVID vaccine provider, and it will take you to the link where you can register as a provider and you'll receive the vaccination. Make sure you give the vaccine to people who really need to get the vaccine. And Mayor Turner has set up a vaccine center, and you can visit the Houston City website and look for this vaccine website where you can register as a general public to receive the vaccine. And if you are not happy with what's happening, you can send an email to the governor of Texas, Greg Abbott, or Mayor, excuse me, Mayor Turner. Here is the mayor's email address. You just go to the city of Houston and you can find their address and find out. So I'm going to skip this part from India, and that's my PowerPoint presentation. I'm going to stop here, and I would like to invite any questions or comments from any one of our listeners and viewers. We have Ravi Tamarisa. Hello, Ravi, how are you?
Hi, I'm doing good. Thank you. How are you?
I'm doing pretty good. And you tell me about your experience. Were you able to get the vaccine, and how challenging was it?
It was very challenging. I was not able to get it.
Yeah.
I was told that St. Luke's Hospital, where I was working for 40 years, I sent email to the staff email of St. Luke's, but I don't follow that since I retired 2 years ago. But I'm still on the active staff. I go now and then. and I'm unable to reach either medical staff services or the lady that is in charge of vaccinating the staff. But finally, I got Herman Memorial System, and I'm booked for 18th at Memorial Heights.
Oh, I see.
And my wife is booked for the 23rd or so at Katie Herman.
Yeah, I think your story is sort of reflective of most people's experience across the city of Houston and across the country, because the Physicians Forum, where I had 365 comments, everyone said the same thing. Every place you call, they don't even answer the phones. And even if they answer the phones, they say, well, we are not taking any outsiders. We're not taking anybody, who are not active staff members and things like that.
Yeah.
Thank you very much. Let me see if I can. Bobby Wadera, Dr. Wadera, who is an active physician. Let's hear his experience. Bobby Wadera, can you unmute yourself and share your thoughts? Hello?
Also, after he's done, can you put that site for registering doctors again?
Okay, sure.
Provider registration site.
Yeah, definitely,
okay.
Yes.
Thanks.
Anybody else would like to, share your experience?
Okay.
Let me see. Okay. How about Kishore? Would you like to share your thoughts? You can unmute yourself. How about, hello? Dr. Vadera, are you still online? You can unmute and share your thoughts. Let me unmute you. How about Ms. Bakula? You have any thoughts? Okay, let me go back to this PowerPoint while we are discussing that. It's called the Texas providers who want to become vaccine providers. That's I would just type in Texas COVID-19 vaccine providers in Texas. And it is at the Department of Health and Human Services, something like that, texas.gov. And if you just Google it, or I can send you the link actually after this presentation is over. Okay, so let me stop this present flower. Okay, anybody else would like to make any comments? We have Kumar. Kumar, would you like to say something? Is Dr. Vadera still on? Hello? Hello? I guess. How about here we have... Okay, if anybody else has no comments, what I would like to do is I would like to end this presentation, and you can watch this presentation on my Facebook page if you just joined in late. And if you have any questions, you can just message me on the Facebook, and then we'll be happy to talk to you. Thank you, ladies and gentlemen, for joining. This was our first presentation for the year 2021, and hopefully we'll get this message to mayors of Houston and Sugar Land and implement that mass vaccination program I'm talking about. We'll see you next time. Thank you so much for joining.
Nick, can I ask you a quick thing?
Yes.
There are so many retired physicians. Harris County Medical Society has a retired physician organization called RPO.
I see.
And there are at least a couple of hundred retired physicians who can also help out in this regard. So if we can mobilize a lot of physicians that have retired, but yeah.
That's wonderful. I will in fact get back to you about that, because I am planning to meet the mayor of Sugar Land and also mayor of Houston, and then share with them and say, there are so many people who are willing to volunteer for these services, and I have addressed every question, including vaccine reactions, things like that. So hopefully we will get information, and we could use all the help we can so that we can get as many people as possible vaccinated in the next 3 months.
Sounds good.
That's a wonderful point.
Yeah.
Okay, thank you, ladies and gentlemen, and we will see you next week.
Okay.